It's the highest per capita in the country. And as cases continue to surge, there's encouraging news about more people getting the shot. But Dr. Anthony Fauci warns more people still need to get vaccinated.
In the breakthrough infections, they are mostly mild or without symptoms, whereas the unvaccinated, who have a much greater chance of getting infected in the first place, are the ones that are vulnerable to getting severe illness that might lead to hospitalization and, in some cases, death. So we're looking not, I believe, to lockdown, but we're looking to some pain and suffering in the future because we're seeing the cases go up, which is the reason why we keep saying over and over again, the solution to this is get vaccinated, and this would not be happening.
Dr. Fauci added that people who are not vaccinated are making the situation worse, and there's, as you just heard him say, quote, pain and suffering for our country still ahead if folks don't take this seriously. Joining us now is Joanne Senoga, an epidemiologist, which is a disease detective, literally someone who searches for the cause along with who's at risk and how to prevent or stop the spread of a disease. Good morning, Joan. How are you?
Good morning. I'm doing good. This is an incredible time to talk about this, and so my pleasure.
Tell us for a moment here, what makes the Delta strain so much more dangerous than others? Just break it down for folks at home who may be wondering about that.
So it is highly transmissible, which means that if one person gets it, 8 or 10 more people are more likely to spread it. And it's spreading right now in household more than community. So if you saw the Alpha variant, it was more community spread. Now it's more household spread. So one person gets it, let's say healthcare worker, and comes back home, spreads it within the house, but it just doesn't stop in the house. And we do not know the period of time when you're safe. If you remember in the Alpha variant, it was less than 10 minutes or 15 minutes, you're safe. We're thinking 2 minutes, 3 minutes, even a simple contact precaution could be possibly what we're looking at. It is comparable to chicken pox. And if you remember when you're young, if somebody in the village got chicken pox, everybody got it. Mm-hmm. So when you look at a situation like Lollapalooza, it is a nightmare for healthcare workers because there was no masking, everybody was next to each other, and within 2 minutes. And we're not, if you look at the Alpha variant, we're waiting for 2 weeks before we see an increase. And I don't think we're going to wait for 2 weeks. I think we're going to be looking into a week's time before we see the rise in cases. So that is why it is deadly and transmissible and affecting mostly young people as opposed to older.
And in line with what you're saying, Joanne, the CDC reported more than 100,000 new COVID cases in just 24 hours. Florida had a record number of hospitalizations and vaccinations. Do you expect to see cases continue to rise over the next few months as we even head into Thanksgiving?
Yes, until they do something with the dire situation. But as you know, on Friday, the senator, the politician just removed the mask mandate. And 10% of those cases right now in Florida are children, kids. The kids are filling up the ICUs, newborns are being affected, right out of birth, and you're getting COVID. They're in critical care, and I'm not sure who holds accountability for this, but this is negligence in terms of letting this public situation happen. So I'm not sure what he is looking at in order to control his state.
And it's scary, certainly, as more children head back to school. Some folks also say, parents I was speaking to even at the airport saying they're worried because their child is going back to school this week. And it just seems so uncertain that it might go back to virtual learning. We know D.C., Mississippi, and Louisiana report the highest number of cases and deaths among Black people. And according to the CDC, Delta is more transmissible than Ebola, the common cold, and the flu. At this point, You are the detective here when it comes to diseases. What is the best defense against it?
So one of it is social distancing, and as we know, that our communities generally do not have, they're living in one bedroom kind of situation. So, and it's multi-generation. Generally, what I mean by that is mom, grandma, and kid is in the same household. So that is a hard control measure. And if you look at India, what actually happened was they could not social distance. It's a privilege to social distance and work from home. And on top of that, then there is access to internet. But those are other complications of lockdown. But also washing your hands, right? Washing your hands 15 to 50 seconds. That is when your hands are clean with all the germs that you've accumulated over. Masking. If you are in a household with a suspected case, an N95 is the one that's going to work, because it means 95% particle to not enter. But also vaccination before that starts. Even if you're partially vaccinated, it provides some sort of protection. So vaccinations are safe, right? They've happened before: measles, mumps, rubella, polio, as you can imagine. And this situation has always happened this way, where people in during polio days were hesitant against the polio vaccine. So do not let this Delta variant become a different variant that happens, because we would not be able to accommodate that. Please, everybody get vaccinated. And I'm begging you from the bottom of my heart to protect you and everybody.
And Joanne, I imagine that this is personal for you, being that you are an epidemiologist who looks at this and you're seeing the resistance of folks who decide that they do not want to wear a mask. What does that do for you? How does that impact you when you see not just the politics, but the health aspect and the combination of it all coming together, just on a personal note here?
Generally, when people think they're not affected, it's very sad, because yes, you might not show symptoms. It might be mild, but remember, the virus has a neurological component to it, meaning it goes to the brain. So if you're getting a little bit forgetful, some people are calling it the COVID-19 brain fog. I hope you're not exposed, but we do not know the long-term effect. So a vaccination is not a live virus, but when you get a live virus into your body, it is most likely to travel to those places and to replicate. So meaning you are going to get the neurological symptoms. It's a multi-system virus. It's just not respiratory, where your lungs are just compromised, but it also affects other system, the cardiovascular system. So you just don't know how it's going to react to you. And it's not even correlated to being healthy. So meaning you're exercising, if even, that might not be helpful, because it's an hyper immune system, meaning your immune system is overreacting. And that is one of the things they've been looking at, where they're looking at kids' T cells being less aggressive, and the older you get, the more you're building more immune system, and that's why they're thinking adults are more likely to have the disease. But now we know even a baby born, a newborn, is getting infected, being in the ICU and the NICU, right? Neonatal ICU. It is not taking any age, any sex, any race. It affects everyone equally.
It certainly pulls at anyone's heartstrings when you hear an infant go through that. Thank you again for the information. Thank you again for joining us here on Start Your Day. Epidemiologist Joanne Senoga, thank you so much.